Welcome back to Healthwise. With us is Dr. Chancellor Donald with Louisiana Oncologists. And we were talking about oncology, and we were talking about chemotherapy because that's the field that he deals with mostly. Doc, can you kind of explain to the audience what exactly is cancer? Because, you know, a lot of people have these theories and they just don't know what it is. And so they don't understand what you do and how. You know, explain just what is a cancerous cell. Or
Sure. I heard it placed eloquently as cancer is wound healing gone wrong. So what you can think of if you cut yourself, the tissues are separated, and then you get a scab that grows in. And then all of a sudden underneath that scab, the skin grows up and the scab comes off, and now your wound is completely healed. But that regeneration, that growth of those cells to repair that cut, that growth can become dysregulated and can occur in the setting of it not being a cut. So whenever we have cells that are growing in a way that's out of the normal control of the body, when these cells don't respond to common things like getting in contact with other tissues, often once you cut yourself and the cells start to grow in, once they contact the other tissues, they'll stop growing. Okay. So once they lose what we call contact inhibition, also when they start to invade into other organs or even break free from that original mass and then move to other parts of the body. Those would be the things that are the hallmarks of cancer. Now, the way we treat cancer would be to try to control this uncontrolled growth. So we give agents that very often limit the growth of these tissues. These tissues tend to grow at a more rapid rate than normal tissues. Therefore, the chemotherapy drugs that we've classically used, they interfere with the growing rate of the cancer. Unfortunately, the cells of our body are still growing and multiplying. So the common parts of our body that grows naturally sort of quickly, such as the lining of our food tube, our stomach,
right,
our hair, our blood cells, these are affected directly by the chemotherapy. And therefore you get alopecia or losing your hair with some agents. You get nausea and vomiting because you're killing off some of the cells that line the stomach. That's how essentially classic chemotherapy worked. Now we're moving a little bit more towards what we call targeted therapy. We have gotten to the point where, to the molecular level, we know what's going on with the cancer. We know that one aberrancy or that one thing that's gone wrong, and we're able to formulate drugs that sort of go in like a key to twist the lock.
Attack that particular
yes.
organism.
And one of the most classic examples of this would be the treatment of chronic myelogenous leukemia, or CML. We now have a pill called imatinib, and now we have several others now that we can give that specifically turn off this aberrant or this abnormal protein, and then it causes those white blood cells that were multiplying on their own to stop. And it allows us not to have innocent bystanders such as hair cells, other blood cells, the lining of our stomach. They're not affected, and therefore a lot of patients don't get a lot of side effects from this type of agent. So we have classic, what we call systemic cytotoxic therapies. We now have targeted therapies that we can use.
Okay. Are there key points that cause cancer? I mean, I know it's the growth, the abnormal growth of cells, but what are some of the trigger points?
Sure.
What is, because a lot of people say, you hear red dye number 2 causes cancer.
Sure.
You hear all these different things. So is there something that,
Sure.
that you know of?
So the class of substances that you're describing are grouped together and known as carcinogens. Carcinogens are substances that we feel induce the formation of malignant tissues or cancers. One of the most abundant carcinogens and the most common carcinogens, unfortunately, is cigarette smoke, and cigarette smoking is a significant health problem. Cigarette smoke can contribute to the multiplication of cells, and then those cells could continue to multiply and become dysregulated and not respond to some of the things that I mentioned earlier. The other industrial things that we know have close associations with cancer, benzene compounds, we also have asbestos, which we know could be contributing to some types of cancer. But to be clear, nothing is 100%. We have several patients that smoke for several years that don't develop
and never
cancer.
got cancer. Right.
We also have patients who have never smoked or never been around secondhand smoke, and they develop cancer as well. So a lot of times we look for links and associations between compounds, but very often there still isn't a nice quick fix to say, okay, if we eliminate this one particular thing, we won't get the development of one particular cancer. Unfortunately, it's not that easy.
Yeah, unfortunately. Well, also we were talking about, so this drug or different classes of drugs. I guess what I want to ask next is, how did we get to that point? How did we find these drugs? Was it a chance, or was it?
You know, oftentimes chemotherapeutic agents are found either in nature, and they could be augmented and changed a little bit, purified, amplified. Sometimes they're purely synthetic compounds, something that was just developed in a lab. Several animal models were using those compounds on animals to see what the response is, and if it's favorable, taking that to human trials. But other times it's also, and this is the newer part of cancer therapy, it's actually looking at the molecular structure and the expression of different receptors and chemicals of cells, and going in and specifically trying to block those to see what the effect is. So classically, we have different compounds that we have used in the setting of cancer to see if we get a good response. But now we're going more towards actually looking at the molecular structure of different cancers and then using molecularly targeted agents to try to combat these cancers.
Okay. Well, when we come back from our break, I want to talk about what you and I were just talking about earlier. A lot of people have this misconception that in Opelousas we don't have, in Lafayette we don't have the best. You know, we think we have to go somewhere else. But when we come back, I want to talk about that and kind of get your take on that, and so you can explain to people exactly what's offered in this area.
Absolutely.
Okay?
I'd be happy to.
And we'll come back after this brief message from our sponsors.